Despite the calls for more testing, there's a shortage of at-home COVID testing kits around the country, and Utah is not immune. A majority of stores across the valley completely sold out as people rush to get tested ahead of the holiday. ABC4's Jordan Burroughs live in West Valley City. And Jordan, you went to several stores today. Were you able to get your hands on a test?
Yeah, I was hoping to get my hand on one of those at-home COVID-19 testing kits, but was unable to. I went to Walmart's, Walgreens, CVS's, Smith's. Out of CVS right now, they're unfortunately out of those COVID-19 testing kits. They've been a hot commodity pretty much for the holiday season, but I did speak with Nick Rupp from the Salt Lake County Health Department, who tells me be wary of taking these, and if you do need to take one, you should go to a testing site throughout the state. If you find yourself wanting or needing an at-home COVID test,
it's not that much more convenient.
And Nick Rupp with the Salt Lake County Health Department says it's not good for the benefit of the community.
At-home tests are a little bit error-prone. There's some user error that happens many times with the at-home tests, unfortunately.
Unfortunately, the majority of stores in Utah are out of stock. This is from CVS Online. This is from Walgreens Online. Even the stores that said they were in stock were actually out of stock when we called. Rupp says getting an official test done at a testing site is more accurate and arguably more convenient.
Because one, you have to go to the store and buy one, find them if they're available, which can be challenging right now, and then you have to be at home and go through that process of swabbing yourself.
CVS sent ABC4 this statement today saying in part, quote, to ensure equitable access to tests both in store and digitally, we've added a limit of 6 test kits per purchase. Due to a recent surge in demand and to retain community-based access to tests in our stores, there may be a temporary out of stocks for these products on CVS.com. Rupp adds testing should be a last resort.
Testing is lower on the list. You know, it's after vaccination and booster. It's after getting masked up in public indoor spaces. And of course, if you are symptomatic, get tested and stay home.
And Dr. Goldstein with University of Utah Health says getting tested closer to the get-together is the right thing to do.
I would recommend, and I understand that the availability, unfortunately, has declined, but rapid testing, if you have the possibility to do that as close as you can to before you get together with family or friends, is certainly advised.
There are various brands of these at-home COVID-19 testing kits, and don't get me wrong, we know that these testing kits work, but as Nick Rupp said, they are not as accurate as those PCR tests that you can get from these testing sites throughout the state. Emily?
All right, Jordan, real quickly, what should someone do if last resort they need a home testing kit?
Yeah, it definitely should be the last resort because you do need to get that PCR test that is available throughout the state. I mean, there are 10, 20, 30, 40 testing sites throughout the state. If you do the at-home testing kit, make sure you not just check the website, but also call the store, because in my experience today, when I called, they said they would have them online. Obviously, it wasn't updated in time, so make sure you do call if you want to use one of those at-home COVID-19 testing kits. Emily?
Save yourself some time. All right, thank you so much, Jordan. We appreciate it.